Good day, everyone, and welcome to another edition of Echoes of Ibeju-Lekki, the voice of a growing community. I am Oladele Olayemi Tosin. Thank you for joining me. Today, I will be discussing something very important, something very important. Primary health centers in Ibeju-Lekki. As we all know that health is wealth and health is very important. This is why today I'll be examining this area, that is neglected or is not really being talked about in Ibeju-Lekki. First of all, I would like to define what primary health centers are. They are the first point of contact for people seeking medical care. They are the first places you take people that are actually either injured, sick, or need first aid treatment. So these are places you take them to. In these health centers, they offer basic services like childbirth, immunization, malaria and typhoid treatment, minor injuries, and even this thing for women, family planning for women, amongst others. And one beautiful thing is there is hardly a community in Ibeju-Lekki that does not have at least one health center. I think Ibeju-Lekki deserves a round of applause. From Ibeju to Orimeju to Akodo to Eleko to Bogije. Should I continue to count? To count them Awoyaya, Lakwe, Shogotedo, Abidjan, Otunla, just name them. There is hardly a community in this locality, in this Ibeju-Lekki, that doesn't have at least one primary health center. This, I think, we should appreciate the government, local and the state government for what they are doing in this community. So I've been to Bogije Health Center, I've been to Lakwe Health Center, I've been to Otula, I've been to Shogotedo, I've been to Ibeju local government, Ibeju health center, among the others. So I'll be talking about the few I've been to. First of all, I would like to say, if you want to go, to these places, unless you are pregnant, don't go on Tuesdays and Thursdays, because this is majorly for pregnant women and for birth registration. I think there was a day one of my children was sick, and I quickly rushed that to Bogije Health Center. Guess what? I got there around 8:30, and I couldn't count the number of pregnant women that were there. So I took her to Lakwe, the same thing. So I had to use a private hospital that day, to treat her. So I will encourage you, if you want to visit these health centers, if you can, please don't go on Tuesdays and Thursdays majorly. And also, before I forget, if you need your birth registration certificate for your children, if you need birth certificate registration, pardon me, for your children, you can also go on Tuesdays and Thursdays. You can visit any of these primary health centers in order to get your child's birth certificate. So it is issued every Tuesday and Thursday. One beautiful thing about this community or healthcare centers is that they are very affordable and even free, and for pregnant women that cannot pay, sometimes they are treated freely. This I can say because I've actually witnessed it. I've been to, there was a day I was there, and well, I cannot remember the, but I know there was a pregnant woman that could not afford, to run some tests and all that. And before you know it, the nurses took it up. They did not send her away. I was really impressed. Please, the way healthcare workers are celebrated abroad, let us endeavor to also celebrate, people in healthcare, people that work in healthcare, the way we embrace them, those people abroad. Let's also celebrate them here. Let's embrace them. Let's tell them, thank you whenever we see them, because these people are trying. Also, they are community oriented. Their nurses are, you know like my own experience, you know they are very nice. They have been very nice to me. The way they say nurses shout and all that, I don't think I've witnessed. I don't think so. I don't know why, but I don't think I have witnessed. I've never witnessed, any of the nurses shouting on me and all that. I've never witnessed it. And also, um some of them have resident doctors, some of them don't. I know Bogije. I've been there. I've met their doctors like twice. When I got there, a doctor attended to me. But Lakwe, I don't know. Awoyaya, yes, doctors attended to me. And I don't know about any other, but I know some of them don't have doctors. They only have matron and nurses, while some have too. So this, but I know that they are good at what they do. They are good at what they do. So if you cannot afford private hospitals, or you just want to treat, and lest I forget to, they have laboratory that they run, minor tests like malaria and typhoid. You want to do genotype test and some other, you know little tests like that. I know they do all these things, but when it comes to total body checkup, that I cannot say. But I know when it comes to all these basic, treat tests, they you can go to them very cheap. For malaria and typhoid, maybe 1,005, 1,000, between 1,000 and 1,005. You can run your malaria and typhoid test. For genotype, less than 2,000 naira, you run your genotype. That these are the things I can say authoritatively, because I have done, and for birth registration, less than 5,000. I cannot remember, maybe 3,000, or between 3,000 and 5,000. You do your birth certificate, birth registration for your children too. What other things? If you have ever used any of them, I would like to hear from you. Was there a time the nurses were mean to you? How are their services like? For me, I enjoy them. Like if I just want to treat, just little, malaria, typhoid, I go there. But when it comes to major, I know where I go to. There are good private hospitals. Don't play. There are good private hospitals in Ibeju-Lekki too. Please let me hear from you. If you have ever used any of them and you would like to share your experience with me, let me hear from you. And remember to please subscribe, like, and drop your comments. Until next week, please remember, health is wealth. Take care of yourself. Take care of your health. God bless you. Thank you for joining me. Thank you. God bless you.